RSV on the rise, especially amongst the youngest. While RSV-related hospitalizations are growing overall, the increases are most dramatic among those most susceptible to the virus, young children. In the Twin Cities, 47 of the 58 RSV hospitalizations during the week starting November 12th were among those of age 0 to 4. The hospitalization rate among those youngest Twin Cityans was 11.7 per 100,000. That is notably higher than the overall rate of 1.9, not to mention the rate of 0.7 among the other group most vulnerable to RSV, those 65 years of age or older. Among the concerns with the certain increase in RSV, the data suggests the state may soon run out of the pediatric hospital bed capacity. Department of Health data show there are currently only 36 unoccupied pediatric beds in the state and only 14 in pediatric intensive care units. Those beds will quickly fill if new RSV admissions for children currently around 60 per week get anywhere near last year's peak of 155 per week. The CDC recommends RSV immunizations for those who are 32 to 36 weeks pregnant. Babies up to 8 months old whose mother did not receive the vaccine, and those aged 60 and older. RSV vaccination rate data are not readily available, but as of November 25th, 14.8% of those 60 years of age or older had received an RSV vaccine. This is notably lower than the 60% of those in that age group who said they would get vaccinated, according to a survey conducted by KFF in early September. Influenza. Picking up, but rates are still low in Minnesota. This year's influenza season is underway, according to the CDC's latest Flu View update. Nationwide, flu-related hospitalizations doubled over the past 3 weeks. The same report indicates that flu activity remains relatively minor in Minnesota. In fact, the state is one of only 5 in the brightest green minimal category, down from 12 states 2 weeks earlier. Minnesota Department of Health data show that the flu is among many racial and ethnic health disparities in the state. In the height of last year's flu season, flu-related hospitalization rates reached over 20 per 100,000 among both Black and Indigenous Minnesotans, compared to 9 per 100,000 among Asian Minnesotans, 8 per 100,000 among white Minnesotans, and less than 3 per 100,000 among Hispanic Minnesotans. That same pattern is already beginning to emerge this year. Although the CDC's state-level data on flu vaccination currently lags back to mid-November, at that time, Minnesota's adult vaccination rate, 43%, was somewhat higher than the national rate of 37.5%. COVID-19 continues its upward creep, especially among older Minnesotans. After a downward blimp during Halloween week, the number of COVID-19 related hospital admissions has climbed back up. The preliminary count for the week ending November 21st is 337. This is likely to be revised upward as data are firmed up, but that number is the highest level of weekly COVID hospital admissions since February. Importantly, the climbing number of hospital admissions in Minnesota is hitting older adults particularly hard, while a disproportionately high number of older adults have ended up in the hospital due, at least in part, to COVID 19 throughout the pandemic. That is particularly the case now. For example, while only 7% of Minnesota's population is age 75 or older, the age group made up 36% of those hospitalized at the pandemic's first peak in late November 2020. Then, in January 2022, peak about 20% of those hospitalized with COVID 19 were 75 or older. For the past several months, about half of the state's COVID 19 hospitalizations have been among those of age 75 or older. As a result, the weekly COVID 19 hospitalization rate for Minnesotans age 75 or older is now more than 40 per 100,000. This is at least 6 times the rate of the general population in Minnesota and similar to the rates for that age group throughout much of 2022. It is also higher than the 30 per 100,000 weekly COVID 19 hospitalization rate for Minnesotans at the very peak of the pandemic. Perhaps in response to those impacts, uptake of the new COVID 19 vaccine is highest among older Minnesotans, 44% of those aged 65 or older, compared to 14% of Minnesotans of all ages, as reported by Axios Twin Cities. The latest CDC data show that uptake of the new COVID vaccine, 27% of adult Minnesotans, is among the nation's highest. The national rate is 16%. COVID 19 levels in wastewater continue to rise. The latest data from the University of Minnesota's wastewater surveillance study shows continuing increases in COVID 19 levels, which increased roughly 21% statewide when comparing the most recent week, November 22nd, to 1 week earlier. The wastewater levels in all 7 of the study's regions increased or remained relatively flat over the prior week, and the Northwest, Southwest, and Twin Cities regions each saw increases in their COVID 19 levels above the statewide average. Over the prior month, the study's 7 regions experienced solid increases in COVID 19 levels. The statewide average increased by 70%. COVID 19 levels in the Northwest region increased by over 100%, the only region to more than double their COVID 19 levels. Statewide COVID 19 levels in wastewater are at their highest point in 6 months, but they remain below where they were in the first 3 months of the year. Recently, the Centers for Disease Control and Prevention updated their reporting on COVID 19 wastewater viral activity. As of November 25th, Minnesota is one of 10 states in which the viral activity is deemed very high by CDC. However, this designation is based on preliminary data, so they should be seen as an indication of trends but not the final word. With the continuing increases in wastewater levels seen in the University of Minnesota study, as well as increasing hospitalizations due to COVID, RSV, and influenza, Minnesotans may want to take precautions during the upcoming holidays, including testing for COVID 19 before gathering, getting up to date on vaccinations, and even consider masking, especially in large indoor gatherings or when around people with higher risk.